Today is part 2 of our 3-part series on hearing aids.
And we're going to be talking about what hearing aids can do.
Hey, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about everything audiology.
And if you're not sure what audiology is, make sure to like this channel and subscribe to it. Hit our little notifications bell so you'll get notifications about all of our new content, and we will be sure to tell you all about it.
Okay, so on our last episode, we discussed some different things that hearing aids cannot do or things you should expect them not to do for you. So today we're going to touch on what hearing aids can do for you. So a little bit more of a positive twist today.
Right. It's important to really understand the fundamental reason for fitting a hearing aid. And it's because we have a hearing loss. What a hearing loss means is that we've lost accessibility to some sound along a frequency spectrum rather. So what our hearing aids are going to do is going to give us audibility. They're going to give us that access to that sound.
Right, so hearing aids are giving you more sound, which doesn't necessarily mean that it's going to be clear, perfect, and normal sound at first. In fact, quite the opposite. If you think about it, it's been a while. When you get hearing aids, it has probably been a while since you've heard sound normally. So it does take some time to adjust to that. The hearing aids are keeping what we like to call the hierarchy of sound, where hearing aids can keep soft sounds soft, normal conversational sounds coming in at that average conversational volume, and then loud sounds will be loud.
Right, and then a hierarchy is a really important thing to remember too, because hearing aids of the old days kind of messed around with that hierarchy a little bit, if, for lack of a better term. Everything was loud. Soft sounds were made louder, loud sounds were made louder, and that's the characteristic of like a linear amplifying hearing aid. They're not like that anymore. There's so many features that the manufacturers have researched and have developed to improve that sound quality, so that for somebody who has, say, a high frequency hearing loss, we're going to create more accessibility for the high frequencies than we would for the maybe mids or lows, because we want to maintain that hierarchy and quickly develop a new normal.
Right, right. And by doing that, a lot of times that will in turn make things sound more distinct, crisper, and clearer. But not always. So that always depends on the type and degree of hearing loss that you have. So it's very important that when you first get hearing help or hearing health care and you're getting hearing aids, that you discuss that with your provider so that you have a very good idea of what your hearing aids can do for you and what you shouldn't expect them to do based on your individual circumstances. Yeah,
appropriate expectations is what you'll hear us say over and over and over. It's really, really important. Another happy benefit of appropriately fitting a hearing loss with appropriate hearing aids is a kind of a reversal of all of the negative statistics that we know about untreated hearing loss. Things like balance issues, cognitive decline, and those sorts of things. What we see when people are fit appropriately with hearing aids over the long term, we're talking long-term benefits, is we can improve balance function, we can improve cognition and memory. It also helps to help with things like depression and anxiety.
Right, and it's all about working that muscle. So your brain, your auditory system is just a giant muscle that needs worked. We need to stimulate that pathway, and hearing aids will do that. So it's giving you more sound, it's working that muscle. So in turn, your auditory system and your brain will be more fit. Yeah,
it's coming from the one who gets me out of bed at 5 o'clock in the morning to work out. Think of it like physical therapy for the brain. Whenever we are continually rehabbing or rehabilitating the brain's ability or access to speech, we're feeding the brain all of that wonderful information that it so desperately longs for, so that we can continue to form auditory memories and really improve or create improvement in speech understanding and quality of life.
Another thing that hearing aids can do for you now with updated technology is keep you even more connected to your loved ones by utilizing something we all know and love, which is Bluetooth. So hearing aids now can connect to your iPhone or Android, and you're able to stream music, which is nice, but you can also make phone calls through your hearing aids. So the sound is much clearer, more distinct, coming directly through the programming that we've put into your hearing aids, taking into account your hearing loss and hearing needs. And that's just a way with everything going on, especially right now, we may not be able to be face-to-face with many of our loved ones, and that's a way you can stay connected and still be able to have a meaningful conversation and relationship with them through getting help with your hearing needs.
You know, that's a really great segue into kind of closing this thing out. The whole point of, and I know this firsthand, the whole point of getting hearing aids, especially hearing aids that have technological advances that allow those types of connections, is communication. You know, the one thing that separates us, as I say to my patients, from the rest of the animal kingdom is our ability to communicate using language. And when we can use language to communicate, whether it's streaming media or music or talking on the phone or communicating face-to-face over dinner or in any of those situations, we know that we can improve quality of life by remaining connected to the people that love us and that we love. Yep. So the main thing that hearing aids will do for you is help you to remain connected, both from a communications perspective and allow your brain to stay connected to the world around you.
Right. All right, everybody, that's a wrap with part 2 of our 3-part series that we've been doing on expectations. So what hearing aids cannot do or will not do for you and what they will do. So next time we're actually going to kind of combine the last 2 episodes, do a wrap up, and it's all about connectedness, and also the big word which we've been saying over and over is expectations.
Yep. If you like what you heard or like what you saw, make sure to leave us a comment down there, or you can always shoot us an email at info@hearwv.com, or give us a call at the office if you have questions, 304-428-2403.
Yeah.
See you next
everybody.
time. Bye.